So why are we talking about this? I mentioned a bit earlier, but just kind of about how SEED got involved and how we've come together, but why we think it's important to be talking about this all together today is that this is an opportunity we can to think about how, as services, we can enhance our family-sensitive practices, which I know most of you are doing anyhow, and it's how can we extend this? And look, already been highlighted, express need from carers. We've heard that a lot today, and Tracy's been highlighting this very, very clearly. And we also just heard then about the, thank you for fitting in some points that fit with my points here. It benefits the individuals and families, carer solidarity, skill development, and also kind of add in there with solidarity with the treatment services too. We mentioned about recovery framework practices. We really fit in with that about the way we're meant to be planning our services. And you know, we're also doing this because people expressed an interest. We've had people talk to us about ways of actually enhancing their family work. They've heard a bit about building hope. They've heard a bit about the work happening at Deakin. So we're thinking, and through eating sort of coordinators meeting or other ways. And SEED's work, we're trying to actually work out how we can assist services developing. So in thinking about coming together as a package, an idea, it fits in with how can we develop a strategy that might be able to assist you, might fit with your services across the state. And this really is an innovative kind of idea about how carers, consumers, mental health services and university are coming together. It's happened some places, but this would be really a good first thing happening in Victoria here. We can get the whole carers, universities and the treatment services all really working together in a way that's useful and it can be evaluated. So the whole aim of this, I guess we should do the bottom one first about talking about really this is we want to actually provide this for enhanced support, psychoeducation and therapy for carers for persons, carers of persons suffering from an eating disorder. And linked with that, of course, is how that can happen is if we can help support and train people in mental health services in the facilitation of this, we can try to disseminate it further. So we've had a few people already, people at Royal Melbourne have experienced it, work with EDV and Deakin, people at Betters have done so, Barwon are doing it. And people that we're hearing today, people haven't really heard about it, how this could be happening. So this is our way of showing it today. And when we got together a group, and it's been a really good, interesting, fun, some big discussions, a lot of football discussion. Genevieve Martin, I tell you, they're football discussions. Anyhow, I went around the grand final. Luckily I was away then. I was on leave. I don't know what it would have been like. But anyhow, we've had a lot of really valuable discussion around what's actually happened, what EDV have been doing, what's Deakin been doing, and like this gap of services not knowing and people not knowing and how it can really come together. So really one of our objectives is how we can offer this implementation as part of services across any of the mental health services, inpatient or outpatient. And with that, helping the training, like Deakin and EDV have been running the courses, and it started with like people like Royal Melbourne. You were sitting in the training, in the course and knowing about it. Holly's doing it. This is probably the first time it's clearly been a train the trainer, I think. Is that right? That sort of, you've taken on that kind of perspective, but we want to actually build that up how, rather than, you know, any good training, you just help people so they can be doing it afterwards rather than just delivering it going away. And as our group, we wanted to really have this sort of flexible kind of really responsive relationship, how we can actually do this package of train the trainer. We haven't all held hands in the group. We're just, you know, it's just metaphorical about how we've been together there. So when we thought about, well, kind of, if we're putting this forward as an idea about what we might offer services, kind of what would we hope might get out of this? And this is, of course, not having a chance to hear from all of you and any services, what do you think you'd want out of it? So just keep in mind, this is what we were hoping we might be able to do. So if we actually offer this train the trainer, like we provide that opportunity for the actual clinicians to come together from services and really learn about it and build some skills themselves and how to do this program. So that's actually the clinicians themselves. And then that can actually generalise into the whole mental health service, having a chance of developing the knowledge and understanding about this and thinking about how that might sit within their treatment delivery. So if that can happen, that would be something we think would be really useful. Then there's just generally that greater resources within the services that actually might be able to train and support other clinicians. So just building on skills and skills and skills. It's the same thing, I guess, everything always sort of, there's parallel processes. Talk about CCSW. So the trainers have got to model certain things so that the parents and carers can kind of learn something, then they can go and model it. So we're just kind of building the next step in of trying to see how we can do that within services, making that available. And this whole, we know there's a lot of family therapy and family work expertise out there. So if we add another kind of area about family work, there's a real cross-fertilisation, and it's happening already, as I think Martin's talked about earlier today, about what's already happening in family work that we know of across the state. There's a lot more that can actually happen about, what can we do? We're doing this in our service now. Maybe we could add this, and we could, think about how does this kind of skills base fit in with our other therapies. So you can really think how it works together. And as Holly highlighted, the fit together about what you're doing in that group, and then thinking about how does that fit with the therapy that's going on with the individual or other family work like FBT. So really that the whole aim is that kind of we can lead to services providing greater care, education and support. So we have grand plans here, don't we? But we think it's a reasonable aim, and we know that from what Genevieve could present about the research about how it really benefits the carers, an area still to be researched about what are the real benefits for the individual with an eating disorder, but for services themselves and clinicians. So the package, which I'll talk about in a moment, is thinking about it being available to the eating disorder programs in the metropolitan services and to CAMS and AMS in the rural and regional areas. So how we do that, again, is a question that's come up already about what happens in regional areas of the state, but this is all up for discussion. Community health centres that work with eating disorders, and we put Monash Links there as an example because they have an eating disorder program, and there may be others that we haven't even heard about that they're doing some work with eating disorders and may be interested to build this in. And within this, we're thinking about how different services might even join together. We know that in an AMS service, for example, there might be a small number of people with an eating disorder diagnosis that are being treated. So you may not have a cohort of carers within one small service, maybe. But you've also got links with the specialist services, the referral in and out of the specialist service and region. So it may be that services come together and think about in a region. So you might join, let's even, for example, at the moment, on top of my head, Monash Links, which sits in southern region, and you've got the Wellness and Recovery Centre and you've got the AMS service. There may be something even between services that might decide to come together, for example. We've already heard in Barwon have got private hospital, the eating disorder service and the AMS all thinking about in their region how they do it. So configurations are very specific to different needs. And the thing that came up in terms of how these groups started, a lot of the groups with EDV were carers that weren't actually involved in any treatment services. They were looking for support. And we recognise that we're going to have times that a person with eating disorder is going to be refusing treatment, but a carer wants support. So our thoughts, anyhow, our idea of something like a group's happening, that it's not contingent on somebody having the person getting treatment in the eating disorder service, that it can be available to people. It might even enhance engagement in treatment, for example. So it's keeping that open. It's not just about registered clients, for example. But these are our thoughts as we go along about how it might work. So just nutting down to kind of what, in a brief covering overview of what the package would involve. So I'm just going to cover this briefly, and I know there'll be more questions and you can talk about it, ask us questions later, and we'll have the package available for people to read. So the idea, obviously, if people are interested in a service to do it, we'll have an information session really to talk through in much more detail about how the group would work with you, what's available and how it could be set up. But the general ideas are that have the information session, and then if it's decided it's going ahead and planning, pre-workshop 6 weeks prior, and we set this thinking about if anybody's run a group program, you know there's a whole lot of lead up to running a group. There's a supervision session offered, which really around the whole of things about event management, what's the whole overview of the actual content of their program, really help the facilitator prepare themselves for the group. And at that stage might be still recruitment, like what's ways to do it, how are you going to do it within your services, how much you advertise, like whatever it might be, learning from what Deakin and EDV have done, for example, and just covering issues around the evaluation procedures and anything about how you might set this up and feeling like really grounded in actually what the program involves. Then 2 weeks prior, once that's set up, there's really by then there should be the group be established who's coming, really about a chance to talk about that group cohort and who's coming to the group. You know, if EDV, they offer the role of an observer coming to the group and being part of it there, so their role, what that might be. Going through what would the first couple of weeks about the program be like. You've heard a bit today about what each session contains, but really establishing for the facilitator of the groups how that might run, and just the last bits about the evaluation and event management. So the idea is so that, imagine you've got the group up and running, you've had that supervision session from Deakin around setting it up. After week 3, there's a chance for another supervision session. And we've put down here about being audio taped and that being an optional thing. This, depending where the service is, this is trying to make it available to regional areas. Like if you can't be coming to Melbourne and it's too hard that way, but you know, it might be more available in metropolitan areas. So the sessions can be audio taped, or it's encouraged anyhow to do the taping, because then it gives you, like any supervision, I'm assuming some of you here have done supervision where you tape your sessions and have a chance for discussion, and the same basis of as you really having a real life example of how it's gone in the session, a chance to talk about it. So, and just it does provide that information, content and style. I know for myself in supervision, whenever I've filmed, when I did my family therapy training, I was filmed constantly. You just learn so much more when you actually look back at what you've actually done. Then the actual, having reviewed that, there might be a lot of issues that are raised, give a chance for the facilitators to talk about that, and overviewing what's happening the next few weeks to the end of the group. So then that's after 3 weeks, and then you get to the end of the actual workshop. 6 weeks we've talked about it being, so 1 week after completion, again having an audio taped copy of the session is encouraged, sent prior to the supervision, and that's a chance to talk about it. So you're getting your supervisor a chance to go through what's happened in those sessions and really look at any clinical issues that have arisen in that session and review what, feeling like as a facilitator, you've learnt from the sessions and the training. And that's going with the actual program itself. What SEED is offering in this, which we would start at the beginning of the process, but at the end really a chance to look back as your service and clinician, what are the impacts and benefits been of this program, and the clinicians, and of course because Deakin's doing the evaluation with the carers themselves through that process, but building a process for clinicians and service to think about what it's been like for them doing this, and then plan of course as any future work or any follow-up required about that. So that's briefly kind of saying at that part, it's sort of pre the group, 6 weeks before, 2 weeks before, into after week 3, at the end of the workshop, and then SEED being involved in thinking about how to evaluate in the ongoing. We've mentioned about Deakin, and just to say again that, as Genevieve explained, this is voluntary. People, but if you were a clinician or a service doing this, all it's doing is asking you to tell carers about the research and evaluation and encouraging their participation, but that's all it is, letting them know. And giving out the packages that were talked about, and then Deakin does all the follow-up. So it's really just information giving about it. It's not actually actively having to do anything about the research, just in case anybody's going, oh, research, it takes so much work and all the rest of it. It's actually just informing, you know, giving out the plain language information and all the documents and those reminders. So, as saying, all the other contacts will be by the research group. So I've kind of mentioning as going along about what's the support offered by the project partners being EDV, Deakin and SEED. So Deakin are offering the supervision for the program, Genevieve and Ross to do that via telephone conference or in person, and research coordinators, excuse me. EDV can be a co-facilitator as requested. No fee. Oh yes, sorry, that's sorry, I should take that, there's no fee, but EDV could be a co-facilitator in your service doing that. And obviously they can assist with care recruitment. So you've got your own client base in your service or region, but EDV will have people that have contacted them that may not have come to your service. And our role here often, as we're doing like today, is organise event management and really the whole evaluation, working with services about how this might come about in your service, how we might help you evaluate, because any of this would be a trial and we understand, and you'd be thinking about, we really want to know not only is it benefits the carers, but is this useful for our service and how we configure things.
Just to also add there, it's not up there, but Deakin also have offered to be co-facilitator as well. as well as supervision. So just as EDV are offering facilitator role, so does Deacon as well.
Yeah. Okay. And being like has happened today, that we, as C's role, we have contact with you, mental health services, all the time. We can see ourselves as a real point of liaison amongst all groups of people within this. And today has come together in terms of working as a group. We've worked together from our meetings to kind of plan this day and come together and present today. So cost, no cost as mentioned. I forgot to take that out before, sorry. So very attractive bit. There's no cost in this. How can you get anything better for free? But it's not like, you know, you pay peanuts, you get peanuts. You know that's not the case in this situation. But we're just trying to make it really available. So it's great that Deacon can offer that service and that EDV can as well. Because really our aim as a partnership here is to provide a program, supervision and support to assist service clinicians to really think about trialling this program, how it might fit for your service, your region. What do you need to do, or what would a service need to do? And we just list them here thinking, I don't think they're arduous, but they're things that you would, I imagine, happen in any of your process anyhow. If you were thinking about this or any initiative you have in your service, I'm imagining all of these things apply. So, you know, if you as a senior clinician or somebody want to do this, you've got to get management agreement and their commitment to the idea of this, because it means obviously having staff. We can hear 1 or 2 clinicians, depending whether you're having a co-facilitator from the group here. So you need that kind of time commitment available, you know, management and services, part of their planning, that this is part of the provision of services to clients with eating disorders and their families. So, and of course there's marketing promotion. I've mentioned about the just provision of the research packages to carers who've agreed to the research, and put down the appropriate EFT facilitation. I don't know if you, I've run lots of groups in the past and it always takes a lot of time around it. So there's time for the group, but you've got to at least double that again for all of the work around it. So it's really that recognition of the service, if somebody was doing it, that they've got the time to do that. And you could ask Holly about what time she thinks involved in that. But, you know, we really think that that has to be supported for any clinicians doing it. And again, not fitting with what I said about we at C want to be available to help you think about any process you want to evaluate the usefulness of your service. So work together on that. So we're offering that. And the usual thing, of course, is there a space to have a group and, you know, tea and coffee. And I raise that, it seems like an obvious thing now to put about a space, but, you know, if you haven't got a group space, it can be hard to fit somebody in, or fit the group in, I should say. So they're the kind of things we've thought of that a service would need to think about if they wanted to run this group. So there may be some questions about what I've said so far. Have people got questions about what really the overview of this kind of plan is? Just a couple of questions, yeah?
Say, for example, Liz and...
Who? Sorry, who?
So, say, for example, Liz and I, we are the 2 facilitators, and we want to run the group, a group before Easter. So it will be planning stage January, February.
Yes.
So who to contact? SID or EDV?
Okay, so that's the actual process. I'll jump ahead. Thank you for asking it, because what we're going to say is what we're doing. Good question. Okay. Very important question. So what we're going to do is...
Sounds like you're interested.
Yes. So we're going to have on the SEED website kind of the package, what fully detailed what we've talked about today. And I'll have just an application, like an expression of interest form that people can fill in, and we'll have a date you can send that back to us. Because certainly our idea is, you know, first in, first whatever, we would actually like to sort of make one available beginning of first term next year. So we're thinking it is like 4 a year, 1 a term at least, really depending what the requests are. If it's actually, you know, supervision or distance through tapes, if it's co-facilitator. But so that's what's going on our website. Look at, it's not there just now. Look next week. What day do we think, Martin, we'll have it up there?
Well, it all depends on today, really, what the feedback is.
Yes.
If people are happy with the proposal, then the idea is to go back to your managers, because it's an investment, and talk to them and get approval, and then you can apply. We would hope you would like to have it on the website by the end of next week.
Yeah. So the actual information and the expression of interest.
There is a lot of information to digest. Are there any other comments, or we're running out of time?
Yeah. Yes, we were going to give you more time. Sorry, we thought it was really important to give the space to hear from carer and group facilitator Holly. So we're very happy to have questions, kind of contact and ask us about it. But look, next week we'll have it on the website. So thank you very much for attending today and your interest and questions. If people could fill out the evaluation form, and please, I said, feel free to contact us. We know it's like we've given you a lot today to think about the program and an idea to think about. So thank you, and thank you once again to our presenters today, Genevieve, Ross, Tracy, Holly and Rebecca.